Now, this issue about proliferation without inflammation is related to another important issue that dextrose does. It proliferates despite use of NSAIDs. Now, NSAIDs are non-steroidal anti-inflammatory drugs. Those are typically the arthritis drugs you hear about. And it's important because you hear it said that you should never take NSAIDs when you're receiving prolotherapy. Now, I hold NSAIDs for 2 days before and after, but that is not based on any strong evidence. If you'll look here, you'll find something very interesting. Dr. Kim, in 2006, published results from a study on rats. They took their Achilles tendon and injected the rat in that right Achilles tendon on days 1, 7, and 14, so 3 times, with 20% dextrose, and they didn't inject the left Achilles tendon. They did one of 3 things with these rats. 20 were given an NSAID, celecoxib, a common one, and they gave it to the rats for 3 days after each injection. So on days 2, 3, and 4, and 8, 9, and 10, they gave celecoxib, and then also after the last one. 20 were given acetaminophen, and 20 were given no medications at all. Then they sacrificed the rats at 3 and 6 weeks after the first injection. Because they wanted to show proliferation, they measured how wide the Achilles was after treatment and how many fibroblasts were present on light microscopy. Here's what they found. This is the Achilles diameter in millimeters at 3 and 6 weeks. Each group increased significantly in millimeters in the diameter of the Achilles tendon. And it might appear here that the acetaminophen group did a little better, but all these groups were significant within themselves, but not between them. There was no significance. And if you look at the next, you'll see the fibroblast count, in this case, almost seems to favor the NSAID group. But again, if you look at this statistically, there was no difference between the groups. So there's no hint here that the celecoxib stopped the proliferation effect here in these animals.